Hi everyone, I'm going to show you 3 great examples of where you can foam roll to help alleviate chronic knee pain. This is very valuable for the 50 plus population because a lot of us, based on my 25 years of working with people 50 plus, have knee issues, and they oftentimes rely on ibuprofen and surgery to help fix the pain. But let me point out, the areas I'm about to foam roll may seem kind of counterintuitive if you have knee pain. I'm going to foam roll 3 areas of my quadricep, my calves, my inner thighs, and I'll give you a bonus area, my glutes. Really quick, hang with me here. When it comes to knee pain, you're working with a stability joint. The knee joint is only meant to hinge. Now look at the joint below it, my left ankle. It's a mobility joint. It needs a lot of range of motion. Now look at the joint above my knee, the hip joint. Like the ankle, it needs a lot of range of motion. When you lose mobility in your ankle joint because of tight calf muscles, and when you lose mobility in your hip joint because of tight glutes, tight adductors, tight hip flexors, when you lose mobility in the hip joint, your body will seek that lost mobility either up higher to the knee, or if it's in the hip, lower to the knee. And again, your knee joint only wants to do this, hinge. When it has to act like an ankle joint or a hip joint, you get that cartilage wear and tear in your knee, patella tendonitis, all those bad things can happen. So what I show a lot of my clients is this. First, you want to foam roll. If it was your right knee having pain, how about trying to foam roll that outer part of your calf in the upper area? You'd cross your left leg over the right, turn both feet to the right, roll that upper outer calf. That's a muscle called gastrocnemius. Back and forth 30 seconds to a minute. Then you would pause, go a little lower down the right lower leg. Hit a second calf muscle called soleus. So I'm more kind of mid-lower leg now, turning both feet to the right. So my left leg is crossed over the right. Just rolling up and down, kind of looking for some hot spots. I may pause, turn my feet to the left. Now I'm getting that inner calf area of my right lower leg. So I'm addressing ankle mobility by rolling my tight calves, and realize both those calf muscles attach behind the knee. And when they're tight, they can definitely pull the patella, your kneecap, out of alignment and cause a lot of wear and tear. The other area you would do quickly, you would foam roll those tight quadriceps. So I'm going to park this foam roller right below my groin area, roll up and down. So I'm right above my right knee, going all the way up towards my hip area, getting that middle portion of my quadricep, an area called your rectus femoris. After about 30 seconds there, you turn slightly to your left, getting some of that outer calf area, outer quadricep area. So I'm rolling my lateral quadricep, just up and down, about 30 seconds. And I'm going to pause, adjust my foam roller. I'm going to roll the notoriously tight inner thigh muscles, your adductors, making my right leg straight, turning my right foot towards the floor, just rolling in and out really quick. This is a notoriously tight area, especially in us seasoned adults from years of sitting down, for example. These tight adductor muscles, your inner thigh muscles, can definitely pull the patella, your kneecap, out of alignment, causing a lot of cartilage wear and tear. So I'm a big fan of 30 seconds to a minute on each side. So we just rolled the calves, the quadriceps, the inner thigh muscles. What you would do last, and addressing the hips here, you'd place your right glute, okay, your butt, your glutes, on the far end of your foam roller, because that's the firmest part of the foam roller. Lean towards the right, roll up and down that large muscle, gluteus maximus. I'm going to get some gluteus medius and minimus here too. But again, tight glutes can cause tight hips. Tight hips can definitely make your body, make your kneecap have way too much range of motion, or make your patella have way too much range of motion, okay? So we don't want the knee to be too mobile. It's a stability joint. Remember, it should be a hinge joint. So I'm taking some tension out of my hips right now, out of my glutes. I took some tension out of my quadriceps. I took some tension out of my inner thighs and my calves. Now, really quick, some of you may be doing this with your right knee bent in your right ankle on top of your left knee, doing this, turning to your right. I've learned through a lot of research and smart chiropractors that this is not the best thing for you. When you place your glute on the foam roller with your ankle on top of your knee like this, you're exposing your sciatic nerve, which can run through that hip complex, through your glutes. And you may actually touch the nerve with this foam roller, which can create a whole nother cascade of problems, okay? So I'd recommend, if your feet were like this, and just lean to the right, rolling up and down, okay? So those tips have helped me and a lot of my clients who are 50 plus years old remedy a lot of knee pain. Remember, so many studies are coming out that point out people 40 and 50 plus years old, even if you have knee pain, a lot of the times surgery can be avoided. A lot of us who are even pain-free, if you had your knee MRI'd, that knee would show a lot of wear and tear and even meniscus tears, and you could be pain-free. So a lot of studies are coming out that point out that after the age of 40 plus, I think 50% of the time, if you have a meniscus tear and you have arthroscopic surgery, I think 50% of the time, that's not addressing the cause. The cause is usually arthritic, arthritis type symptoms, which can be minimized with better postural exercises by foam rolling, for example. It can definitely help improve posture, help improve joint alignment, okay? So just my 10 cents. If you want any more help on that, just reach out to me. I'll post again here soon on why you should not foam roll your IT band. All right, take care.